So it's not the most lighthearted conversation to have, but I really hope that you'll walk away having learned something because, as we'll discuss in a second, knowledge is everything when it comes to falls prevention. So we'll skip the next slide because Kirby kind of outlined my my history, my education. But like he said, I've been in Meaford for the last 10 years, and if I've met some people out there, this is what I look like, because the last 2 years I've had a mask on my face. So if I don't know you, it's because of the masks. So you do not have to answer this if you don't want to, but how many people in the audience are afraid of a fall? A good number of people. So the statistics say that you are worried for a good reason. 1 in 3 seniors age 65 and older were fearful of a fall when Stats Canada did a study back in 2008-2009, and it is the most common injury among Canadians of any age, not just of seniors. 1 in 3 seniors over 65 will experience a fall in a year time frame. So that's a massive statistic. And the injury-related hospitalizations, most are because of a fall. So that's not because of a fall in your driveway per se, but it could include a fall in a sports scenario as well. So these risk factors we'll go through more specifically, but actually having a fear of falling increases your risk of falling, which is really frustrating because you think you're being cautious, but it actually being fearful can increase that risk, as well as chronic and acute health conditions. So this is MS, Parkinson's disease, previous stroke, heart attack, diabetes, balance and gait deficits. This could be from an old sports injury. It also could be because of Parkinson's, which if anyone knows of someone that has it or has it themselves, there is lots of gait deficits that go along with that. Sensory factors, so vision loss. How many people have had vision loss in the aging years? Yeah. Vestibular changes, so this is how our body knows how to balance, our equilibrium. It comes from the inner ear. This starts to change as well with age, as well as just tactile sense, and we'll talk about that more in a second. Another is inadequate nutrition. So that's one big thing you can make a change in your life very easily. It's making sure you have enough vitamin D, enough calcium in your diet, and that you're nourished enough, because not having enough food causes lightheadedness, fatigue, which are all risk factors for falling. Living alone or social isolation can contribute. And then one of the biggest things I want you to walk home or do when you get home today is look at your living environment. So your home, your outdoor setup, where are the risks for you to have a fall? And postural hypotension, does anyone know what that is? I know it's a very fancy word for getting lightheaded when you sit up too quickly. So it's that your blood flow hasn't regulated enough. So sit, take a second when you're getting up to go to the bathroom in the middle of the night, or to get up for your day, or if you've had a nap and you're getting up. We're always in such a rush, and these little things can make a big difference. And then polypharmacy is being on too many medications. I'm sure a lot of you out there have a number of medications you're on, and if you're concerned, this is an easy thing to talk to your pharmacist or your physician about, to find out, are they interacting appropriately, or are they increasing your risk? So symptoms you might experience are fatigue, dizziness. This is worth the conversation with your doctor. So another wonderful thing us women do is we worry. So women are twice as likely to be fearful of falling. Obviously, this gets worse as we get older. It worsens if you have 2 or more chronic conditions, and chronic conditions is diabetes, osteoarthritis, anything you're pretty much taking those medications for. Being on 3 or more medications also increases your likelihood. And when they compared people that were fearful of falling and those that weren't, they were twice as likely to have a fall, those that were fearful. And you're in a group right now where they encourage you to get together, to be active. That will help. Being afraid of falling can negatively influence your desire to go out and do group activities or to go and participate in a social activity. So balance and gait. So these are things that are not necessarily a guarantee as we get older. And I found this statistic really interesting that up to 20% of older adults do not develop any sort of gait alteration. This can be a bit of a fun game when you're out and about, is watch how people walk. You can learn a lot about how someone is moving and maybe an issue they might have. So as we age, we tend to go wider with our stance. This increases our base of support. We might flex forward. A few of you have maybe heard of the word stenosis or degenerative disc disease, all of which sound very scary and are just all part of normal aging. So even in your 30s, you start to develop those changes in your spine, but it often feels better to lean forward. And these gait alterations can actually increase our risk for falling over. The aging population also has reduced strength when they toe off in the gait process, as well as more time spent in double support. So when we walk, we strike our heel, we put our weight through our foot, and then our opposite side is toeing off. So in those that are having some gait changes, they spend more time where both feet are touching the ground, as well as have a shorter stride length. That makes sense. Okay, so here's some examples of risks in the home. So can anyone find something wrong with this picture? So you can see she's wearing flip-flops, probably not the best shoes to be wearing walking around the house. So poor footwear. Really loose, disorganized rug. That's something you can look around at your house when you get home. Do you have non-slip mats underneath? Are they in kind of a bad location where you're maybe going to catch your toe? Or lighted. This is often what I hear from patients when it comes to going to the bathroom at night. They can't see, they tripped on the dog, or they caught their toe on their hallway in the corner. So set up a little night light so you know your path, because often we're getting up in the middle of the night as we get older. Cluttered, so lots of things in the way. Cluttered stairwell especially, don't put stuff on the stairs. Never a safe idea. Pets, they're adorable, they're definitely fall hazards. They like to lay in the worst spots, and if you've got something in your hand and you're not looking, you can easily trip on them. For Janice or Gait, it's not helping her being way far away from where she's standing. Yeah. Loose electrical cords. That's another thing. Just have a quick peek. Are they sticking out where you might step to grab something? You can take these things down or figure out a way to cover them. So if anyone here has diabetes, one of the things that come along with diabetes is you start to get changes in your sensory at your feet especially. And this is termed peripheral neuropathy. 7% of people globally suffer from this. And what is interesting is things you can look for, which is if you're starting to lose sensation in your great toe, a study showed increases your likelihood of having a fall, as well as vibrational sense. So we have a spinal cord, it tells us information about what we're feeling. Heat, cold, vibration, 2-point discrimination. These are things that a physio would look at. But specifically, if you're losing that sense to vibration at your feet, it can be an increased likelihood of having a fall. So having tactile loss of your feet, obviously reduced strength comes along with that, impaired balance. Nutritional deficiencies come along, certainly with diabetes, and it can alter your gait. So look at your feet, take care of your feet, and if you're concerned, these are things to bring up to either your physiotherapist or your physician, because they can also send you out for blood work to make sure your glucose levels are okay. So nutrition, anemia is an iron deficiency. It's not an uncommon thing to have, but it does increase your likelihood of feeling dizzy or fatigued. Having significant weight loss. So often a physiotherapist will ask this question, have you had a sudden loss of weight loss? Not because of exercise or diet changes. Often we're asking because this can mean some sinister things are happening in the body. So if you've had that, I'm not asking anyone to answer that right now, but these are things to bring up with your physician. But if you've lost more than 5% of your weight, total weight, in 30 days, that's considered significant. Or vitamin D deficiency. These are things you can make a change, adding iron to your diet, vitamin D, calcium with bone health. Look around at the Canada Food Guide, find out where you're lacking. Maybe you've had recent blood work and they've told you to supplement, which is great. But a dietitian can also be really helpful to guide you along what foods are appropriate for you. Another thing, often when I was working in patients, is blood work is done pretty often for patients and hemoglobin levels. So hemoglobin tells us how much oxygen your blood is carrying. And it really tells us how much energy this person's going to have. So if someone's falling under 100, usually on the scale that they have in the hospital, I know that I need a partner with me or following them with a chair. Some people are functioning with much lower than that in society, which is really putting them at risk of feeling dizzy and having a fall. So things that physios do, physicians do this as well in an exam, is we do neurological exams. We look at the muscles and the sensory system of the lower and the upper body. Reflexes, we do upper motor neuron testing. These little tests tell us a lot about what's going on in the body. Sometimes these upper motor neuron signs mean there's a neurological condition that's gone undiagnosed. So these things are really easy to pick up on and we often send letters to the doctor to suggest further testing. Gait assessment, like we talked about, is a big piece. And then there's some balance assessments that have been found to be quite reliable that give us an idea of how risky someone is of having a future fall. Talk about fall risk too. So how many falls have you had in the last year? And then certainly talk about the circumstances of those falls as well. Functional evaluation. Can you stand up from a chair without using the armrests or using your hands for support? This is sometimes surprising for people when we do it in clinic. A chair like you're sitting on right now is a standard chair height. It's 17 inches. So for someone that's a bit taller, that's obviously a little bit more difficult. But hopefully you're not finding that you're leaning into your thighs to get up from that chair. And if you are, some exercise would probably be helpful. Bed transfers, so are they able to sit to lay down independently, rotate from side to side? We talk about all those environmental risks in the home like we've already discussed today, and then certainly go through their health history. So this is a really simple test we'll do in clinic. You set up a chair, the person walks 3 meters, they turn around, they walk 3 meters back, and they sit. If you are greater than 12 seconds to perform this, you are at a higher risk of having a fall. And when we're doing another evaluation, sometimes we'll have the person count backwards from 100 by sevens to see if that dual task influences their ability to complete this walking test. Another good one is called the Berg balance assessment. This is quite easy to start. Can you sit unsupported without your back on a chair and not fall over? Can you stand unsupported? Can you stand there with your eyes closed? And then it gets harder. Can you alternate tapping one foot on a stair without holding on to anything? Can you stand heel to toe for 30 seconds? Can you stand on one leg without falling over? So like we discussed, falls, it's a multifactorial problem. It can't just be dealt with by seeing one person, one physiotherapist or one physician. You really need to attack this from a team approach. Talk to your physician or your pharmacist about your medications. Maybe talk to a dietitian about targeting the nutritional deficiencies. Education, well, check that off. You did it, you've listened. Mobility aids and proper footwear. This can be assessed by both occupational therapy and physio. Occupational therapists also come into the home and they'll check to see if there's grab bars needed in the bathroom, a higher toilet seat, those kind of things that will help improve your function in the home. Exercises, we're going to talk about in a second. And then all these group programs, BON offers them, Tai Chi, and then there's a laundry list of activities offered by Probus, all of which would target everything we just discussed. So some simple exercises. For those that are pretty fit, these are easy. And I'll tell you in a second how you can make them a little bit more challenging. But the first exercise is just stepping on a stair. So don't go to the top step, do this on the very bottom. Hold on to a railing and just alternate left and right and left. What's nice about this exercise is you can use it as a cardiovascular exercise because stairs get that heart pumping, works on balance, and works on all those important balance muscles like your quadriceps especially. The other thing is if you do it alternating, it works on a movement sequence, which is actually good for cognitive function. Next is calf raises. You can do this while your coffee's being made in the morning. These muscles are used for walking, or certainly for balance, and a lot of the sports that you're doing in those Probus clubs. Bridging. This, laying on the bed with your knees bent or on a firm couch, and you're trying to lift your bum up into the air, trying to create a straight line between your knees and your shoulders. So if you try this at home and you feel like you're getting a Charlie horse, you need to do this exercise. It helps with bed mobility especially, but what's awesome about this, it's a core exercise. I'm sure you've heard that buzzword, core, which is abdominal strength. Your bum muscles and your hamstrings, the back of your thigh. And then just like we discussed before, the sit to stand. Sit to stand on a chair without using your hands for support. You can do this repetitively, gives you that cardiovascular challenge, but it also makes sure you can still do it. Tandem balance. So this one is especially difficult. People always make the joke in clinic that this is the sobriety test. I can't say any police officers are still doing this in the field, but standing heel to toe, making sure you do both sides. The more in line your feet are, the harder it is. If this is too hard, you can bring your leg off to the side so your base of support is wider. If this is too easy, there are ways to make this harder. So standing heel to toe, and like we said before, we get balance sense from our inner ear, from vision, and from this proprioceptive system of our ability to know where we are in space. So you can play with vision on this one by looking side to side and see if you can stay in that position without falling over. You can do a secondary task, like throwing a ball in the air or against a wall. You can stand on an uneven surface, because how often are we walking on a perfectly level tile floor? Maybe at home if you've had a good contractor. But when you're out and about, gravel, pavement that has potholes everywhere, grass, the beach, this is uneven support. So why not practice this at home? So stand in your yard with bare feet, with sandals, with running shoes on, any footwear that you would typically wear, practice your balance in that footwear. If tandem balance is too easy for you, you could always go to single leg stance. I often say that you can hold it for 60 seconds, you're doing just fine. This is harder than it looks though. This last exercise is just marching. So these are exercises, again, cardiovascular, but it also works those quadriceps, which are hugely important in our balance. So these are just some examples of activities, whether it's home-based exercise like we just discussed, Tai Chi, yoga, doing a resistance training program with light weights, which is actually recommended for women that have osteopenia, which is pre-osteoporosis or osteoporosis. Swimming, cycling, walking, hiking, snowshoeing, get active. That's the most important message here is if you don't use it, you'll lose it, right? So cycling, these are the activities I just pulled from the Provis website that's offered in this club. So some benefits of cycling, works those quadriceps, which are great for balance. It's obviously a great cardiovascular exercise. It helps with coordination and posture. However, if your goal is bone density, for women that have bone density loss, walking is more advantageous. Not that cycling is bad, but that walking is better for that specific purpose. The caveat to the cycling component, there is risk. Falls happen because of cycling accidents. So be smart. Proper fitted helmets. Maybe set your seat mount a little lower so you're not gonna have a fall getting on or off the bike. Did anyone see the Biden video? Biden falling off his bike, right? So it happens to presidents as well. So be smart, ride in good conditions. Go with a friend, bring your phone. So if you do have a fall, you're able to get a hold of someone to come and help you. Canoeing and kayaking. So anything that involves your upper body is actually very beneficial to the metabolic demand, so burning calories. It also helps to build postural and shoulder strength. Now, when I researched this to find out the benefits of kayaking and canoeing on balance, there isn't a lot out there, but there was a study that showed a ground kayaking program was really beneficial to cognitive function, because it comes back to that piece of movement sequences. You can extrapolate this data for dance. When you're having to memorize a movement pattern, you're bringing blood flow to the brain. And as we know, this cognitive function just steadily declines as we age. So why not work on it so you can slow that decline? Walking and hiking. There is more than enough data to suggest that walking is beneficial for pretty much everything. It's great for socialization, it's great for reducing all risk mortality. So basically, it's a great way of improving the length of your life. It's good for reducing the risk of cardiovascular disease, cognitive decline, functional limitations. Women that are postmenopausal get improved bone density, improvement in blood lipids, glucose tolerance, and reduced blood pressure. So this other study I found was talking about why hiking is beneficial. So on top of having enjoyment of being outside, I think that's a stress reliever, they also found that your foot is stimulated in a whole new slew of ways because you're on uneven ground, and so it's making the foot work more, and it's making those receptors send messages to your brain and your brain to interpret what to do to keep you upright. So it's working that motor control more. And so that proprioceptive system, which is one of the things we target a lot with physio, improves, which reduces your risk of having a fall. So does anybody have Nordic poles? Excellent. I could talk all day just about Nordic walking poles. They are so beneficial, not only for balance and reducing your risk of having a fall, especially on an uneven terrain like when you're hiking or snowshoeing, but it actually is 90% of your muscles working. That's what activity does that. It's much better than walking alone, burning between 25 to 46% more calories. It increases walking speed. And the nice thing is they also reduce the load on your joints. So if anybody has hip, knee, ankle osteoarthritis, which is an age-related degeneration of cartilage, pounding of weight bearing makes these pains worse. So if you can unload some of that by using the walking poles, how wonderful. Plus you get a better workout out of it. I found some studies too that showed how great it is for fibromyalgia, which is chronic pain, often a diagnosis of exclusion. They don't know what else it is, so they kind of label it fibromyalgia. This helps increase physical function in this group, muscle strength and endurance, and improve self-esteem because they feel like they can do more as a result of using these Nordic walking poles. Parkinson's disease, it helps with motor skills, impaired functional mobility, speed, and walking distance. And then you also get the added benefit of VO2. Often we use this as a measure of athleticism. But everybody gets a VO2 score of how efficient you are at using the oxygen you bring into your body, and Nordic walking poles can improve that as well. So when you get home, or if you're thinking of purchasing these, think about buying the right product. And what I've learned in my research is you get what you pay for, like good shoes or a good mattress. So Lecky, Excel, Gable, Swix, these are some companies that been around for a long time. Maybe avoid buying them on Amazon from a Chinese manufacturer. You're looking for something that is about 70% of your overall height. And when your handle is on, or your hand is on your handle, your elbow should be around 90 degrees when it's right next to your body. If you are potentially between two sizes, aim for the shorter length on the Nordic walking pole. Look for something that's lightweight, it's stiff, it feels durable, it dampens vibration. So if you do buy it at one of the ski shops, make sure that it catches some of that vibration. They often have a rubber tip, and that it's quiet. It's not making lots of noise. I think that's a good sign that it's made well. Now, how to use them. There's some different methods or different ideologies. The European kind of viewpoint is to increase your walking speed significantly, where your shoulder is coming quite forward and you're using it as you would if you were skiing. The American version is to just extend it as far as you would if you were shaking someone's hand. So it kind of reduces the strain on the shoulders as a result. Cane and crutches. I don't see very many canes out there in this group. So I want you to remember this if you don't need a Gait aid, or if you have that total knee scheduled or total hip, because I guarantee you will be using a cane, a crutch, or a walker in that post-rehab. So the handle of your crutch, cane, or walker is right at the crease of your wrist. So where your watch is, that's where the handle should sit. Put your elbow at a 30-degree angle. And this is the thing that people often are surprised by. It goes on the opposite side of the injury. This can get a bit more complicated if you had a stroke on the other side. But generally speaking, it goes on the opposite side of your injured or weaker side, and they move as partners. So if my right leg was my weaker side, or this is my total knee I just had done, my left hand and right move together, and I swing through with my left foot. Height of the walker is the same. It's at the crease of your wrist. And this is the first week to 2 weeks after a knee or a hip. Often a 4-point walker is used, and your weaker side comes into the walker first. And that's usually walking in a step together gait. If you're able to walk normally with a walker, it's likely time to move on to something a little bit less stable like a cane. Stairs. So when you're climbing stairs or descending stairs, we use this poem, good foot to heaven, bad foot to hell. And I find that sticks in the brain really well when you're on potential opioids after surgery. What am I supposed to do climbing those stairs? Good foot leads going up, bad foot leads going down. Okay, when you're out and exercising, rule of thumb, if you can talk, you are okay to continue when it comes to a cardiovascular challenge. If you are so out of breath that you can't answer your friend's question, it's time to sit down and rest. Bring your phone. Most people have them these days. If you don't have a phone, make sure your partner has a phone. Walk with a friend. This is not only great for social activities now that we're a little less scared to be around other human beings, but it's especially good to make you feel that you're counted on by another person. So you're not going to say, oh, I'm tired, I don't want to go for a walk. No, get out there and get moving. And start slow. If you set realistic, achievable, measurable goals, we're more likely to continue with that exercise regimen. Pain. This is a question I get asked often. Do I work through pain? Usually no. Exercise doesn't always feel super comfortable. Having muscle burn is okay. That means you're growing those muscles. If it hurts, if it's stabbing, sharp, achy after, maybe swollen, these are signs that you've stressed something, you've gone too far. So this no pain, no gain mentality does not apply often. But yes, stretching, well, it doesn't feel awesome. And certainly when I'm working out, my quads are on fire, which is a good sign. And then shoes. So the things that I look at when someone comes in with Achilles pain, with arch pain, plantar fasciitis, I'm sure someone out there has it because it's pretty common. Maybe even knee pain. Shoes. What are you wearing? What's on your feet? I'm wearing probably the worst shoes I own right now. But if you're wearing a running shoe or hiking shoe, look for two things. When you twist the shoe, does the arch fall down? Can you break it? Or when you squeeze the heel, does it just disintegrate in your hand? Or does it stay rigid? If you can find shoes like that, you have a better likelihood of having stability built in. In a hiking shoe, if you're going to be on kind of a more graded terrain, uneven surface, high ankle hiking shoes offer a lot more ankle stability. So something to invest in. Maybe in the summer months, you don't want to have all that coverage, but they are certainly better. So these are just some local programs in addition to what's already offered through Provis. Here in town, they do a seniors exercise program at the library. And then Meeker has a number of pickleball, there's a dance it out. I believe these are offered at the hall. In the winter, there's walking club at the arena. Anyways, there's the link here. So if you guys have access to the slides, just click on the link and you should be able to get to the municipality website and find out the details of those programs. Questions? Mm-hmm.
I just wanted to let everyone know that pharmacy carries the Nordic block. And Provis Club members will get a discount.
Oh, great. Everyone said that part. pharmacy has Nordic walking pools, and you get a this discount. Excellent. Thank you for that.
Again, I have a question or a suggestion. TELUS has a device, if you carry it, and I'm not playing hope, but if you fall, it alerts, and one of the shortcomings of it is just a brief movement that causes me to get a phone call from there. But that's better. That's better. And the other thing that I learned is one of the things that I walk in the winter that we haven't had occasion is I'm afraid of slipping. And I have found out that you can now get boots and shoes with grip on the bottom that it took me 83 years to find that out. It adds stability to walking on snow and ice.
Exactly. And around here, we have a lot of snow and ice, right? So, and tell us, and I'm sure there's some other companies that do offer those sensors, but you're right, they can be a little hyper vigilant if you.
Yeah.
And there are some good brands out there that do make a really rigid undersurface, like they're designed for snow and salt, and you can get not like a crayon, but you can get like an undersurface, exactly, that if you're wanting more traction, because ice is ice, right? And that those are those environmental factors that if you can avoid those areas or maybe invest in treadmills, you get your walking, but it's indoors, it's on a flat, stable surface without all those risk factors. But that's almost half the year after, isn't it?
Just a comment, and we for the VON also has a senior program. It is not operating right now. We saw when COVID started, but we're moving through it again. And it's called the SMART program. Seniors maintaining active roles together.
And is that on the municipal website too?
No, and I don't know why, but it's not through the municipality, it's through VON.
Right. And I don't know how, if all of them are through the municipality, I wonder if they put that on the website so that people would have access to it.
Yeah,
Absolutely.
as I said, though, it's not operating right now, but they're hoping to start it up again.
Yeah, there's no shortage of opportunities to get it and build that confidence, right? Any other questions?
I have one. It's regarding muscle mass. As we age, 70s, what's happening, we're really going down with muscle. I'm at a stage where I've got it in my shoulders, and now it's in my hips, my legs. I can control it. I realize vitamin D, DHEA, which is a herbal. There are ways, but my understanding is it's almost impossible to lost, maybe to tone what's that. Can you expand on that?
Yeah, so we have a fancy word for it, full atrophy, and absolutely, there is very little in the body that doesn't slowly degrade with age. Other than wisdom, I've decided, that's the one thing I look forward to is your wiser. But yes, shoulders, core, leg strength, all of that does degrade. You can't stop it, but you can slow it. And it's that whole idea, if you don't use it, you lose it. Having appropriate nutrition, like protein is a big muscle builder, but exercising, so not just walking, but doing resistance training like the bridges, doing sit to stands or squats over a chair, doing lunges just to the extent you can. That will help you slightly negate some of those wasting. This is a shocking statistic. 30% of your quadricep muscle mass is gone in 3 days of bed rest. Huge. And it takes months to get it back. So if you stay on top of activity, you stay active, if you start getting into that exercise program now, you have some chance at reducing the loss and maintaining the function that you want. Yeah. I'm sorry, I'm really happy for something.
Just as an add-on to what you just said, many people say to shrink because of the backbone. Is there some way to slow that down, reverse it, stop it?
It's called moving to the moon. So our disc, guess how much water is in those discs that sit between our vertebrae? 80%. So you are taller in the morning because that water flushes in. So hydration plays a bit of a role here for sure. Swimming, being in a pool, because you're unloading some of gravity's detriments to our body. But the caveat to that for postmenopausal women is that loading the bones is key to stop the degradation of bone tissue. Any guesses when women hit their peak bone density? What did you say? 12, 25. It's a steady decline from there. Men are closer to 30 when they hit their peak. So hopefully you were a big milk drinker as a kid. Yeah, but the pool does help. Posture. That's another big thing I see in women as we get older. And there's a number of factors that happen, but you might start to see this. So us short women especially, because we're so used to tipping our head back to talk to people. But thoracic mobilizations, sitting in a chair with your hands gently behind your neck and extending that thoracic spine can help and mimic a little bit of this. We're also a generation of a lot of desk workers. And what do we do when we sit at a desk? We slump forward. When we're watching TV, when we're texting. One thing I like people to challenge themselves to when you're driving home, can you get the back of your head to touch the headrest? But you can't. I struggle with that. But we can do this. We forward head posture and it just steadily starts to worsen. So if you can start doing some thoracic extensions and get that feeling more comfortable, that can make a big difference. Any other questions?
What would cause pain to the heel?
Often plantar fasciitis. Plantar fasciitis. So we have a connective tissue that goes from the base of our heel to the base of our toes. All it is connective tissue, but as we lose strength in the intrinsics of our feet, or we let our feet fall inwards into like we call it pes planus or pronation, it tugs, and then the insertional point becomes really irritated. If you've had it for a long time, it can even develop a spur, which is called an enthesophyte, and its calcium has built up, and it's so old that it's actually caused it to become a bony formation. Strengthening your feet, crunching your toes, trying to lift a towel or probably your cat toys up, using your toes and moving them around can help. Stretching your calf muscles to keep them loose can help. And it just comes back to really good footwear. Yes. So I luckily suffered from that since I was a baby, and I still have to wear shoes in the house. I find all the flooring that's become the fad is tile, hardwood, concrete flooring. And unless you had wore shoes your whole life, when you finally go barefoot on a hard surface, you certainly feel it, don't you? So good slippers in the house makes a massive difference. Cushion and something that has back support so that you're not slipping and have a potential for falls. Yeah.
There's nothing there. Sorry, my fingertips are similar.
So, it could be, what I was discussing before, which is peripheral neuropathy, that the messaging is slowly degrading, maybe because of blood sugar problems. It could also be a neurological condition. Sensory loss is either neurological or circulation. Coloration changes. Some people will get a white color in cold. That's called Raynaud's phenomenon. That can happen at any age. But purple or bluish color to the feet and the hands is a circulatory problem. What can you do for it? Sort of nutrition and blood work and checking to make sure you don't have another chronic illness that needs to be addressed, certainly by doing blood work or seeing your physician. Pharmacy does carry a product where you put your feet on it and it's supposed to kind of buzz and it's like a 10 unit, and they say that that's helped improve circulation. Another thing to do, pump your ankles. Anyone, I assume everyone's pretty travel, to travel. So on the plane, you know how they recommend you pump your ankles back and forth. That helps encourage the blood from pooling in the calf and at the ankle. That might help. If someone is hypersensitive to touch, often it's because of maybe pain, and I'll recommend using different textures to desensitize the tissue, and arguably you could encourage the neurological function the same way. But if you're starting to get that, like I said, there's that risk of falls because you're not feeling where you are in spaces as well as you would have before, and so you might step and not realize and go down and cause hip pressure or something like that. Definitely something to talk to your doctor about. Yeah. Thank you. No problem. Nothing else? I feel like everybody probably has a list of 8 things we'd love to discuss.
Thank you.
Yeah, I just wanted to thank you very much. That was a very educational and eye-opening presentation. I know I've got some homework to do now and some exercises to do and try to keep. And I think this is very important to all of us and to all members here to keep everybody healthy and on our feet as we age. And I think this will help us along the way. Just on behalf of the Provost Club, I just wanted to thank you honoring on behalf of the club for your speech today, and we really appreciate it. Great job. Thank you.